So today we'll be doing confrontation test. There are a few precautions or prerequisites that have to be fulfilled. The first thing, the eyeglasses should be worn by both the examiner, i.e. the physician, or and the patient. So that's the first prerequisite. The second would be both the examiner and the patient need to be sitting at the same level. As you could tell, the orientation of the chairs, uh, they have to be almost 1 meter apart so as to facilitate the movement of your hands, which has to be in the plane midway between the patient's eye and your eye. The third thing is that the patient needs to be closing the eye in front of your closed eye. هستاذن حضرتك عم سيد بايدك كده تقفل عينك الشمال وتبص طول الوقت بعينيك في عينيا، ما تتحركش بعينك في اي حته وما تمشيش مع صباعي او مع ايديا. حضرتك طول الوقت باصص بعينك اليمين على عيني الشمال. So every now and then, if you see the patient's eye wandering here or there, you should remind them to refixate upon your uncovered eye. The technique we'll be using is the colored tip of either this tube or the colored tip of an eye drop bottle or the colored tip of a pen, any colored tip. So we'll be asking the patient to let us know whether they see the colored tip in each of the quadrants. استاذن حضرتك طول الوقت يا عم سيد عينك في عينيا وانا هحرك بتاعه حمراء. حضرتك اول لما تشوف البتاعه الحمراء تقول لي اوكي. كده شايف البتاعه الحمراء؟
فوق.
Okay. So of course it's a comparative study. So whenever I get to see the red tip, the patient needs or if they have a proper or a normal visual field, they should be seeing it as well. Of course, we'll make the movement from the periphery to the inside, from outside to in 4 quadrants, here and there, and here and there. But a tip to be said here that whenever you're switching to the nasal field, instead of doing it with this awkward orientation, all you could do is switch hands, swiping your right and left, and using the easy hand to carry on the movement in the visual field. I'm just explaining prior to actually demonstrating this on the patient. استاذن حضرتك طول الوقت يا عم سيد تبص بعينك اليمين على عينيا الشمال المفتوحه، واول لما حضرتك تشوف البتاعه الحمراء قول لي. شايفه كده الحمراء؟ اوكي. اول لما حضرتك تشوف البتاعه الحمراء قول لي. شايفه؟ And now, after having swapped the hands, we'll recheck the nasal fields. Again, coming from the periphery to the center, asking the patient whenever they see the colored tip, they should report back to us. حضرتك شايف البتاع الحمراء؟ اوكي. حضرتك شايف اي حاجه كده؟
لا.
لسه عينك في عينيا طول الوقت؟
لا.
من فضلك برافو عليك. برافو عليك كده ايه؟ ممتاز. Putting into consideration that all my movements are more or less in the plane midway between the patient's eye and my eye. So this plane, this is where I move. This is midway between the patient's eye and my eye. And of course, after having finished this eye, I ask the patient to uncover this eye and to repeat it on the other eye. استاذن حضرتك تقفل الناحية التانية. And likewise, I'll be covering my other eye and then rechecking this eye as well. شكرا.